Okay, today we have discussed about what are healthcare waste and its management system. Those are course outline of healthcare waste and its management system. So first of all, define what is healthcare waste. Healthcare waste is the waste generated by healthcare facility, medical laboratory, and biomedical research facility, as well as waste from minor or scattered source. Healthcare waste include all the solid or liquid waste generated as result of any of the followings. From those are diagnosis, treatment, or immunization of human beings, research pertaining to the above activity or diagnosis, treatment, or immunization, research using laboratory animals for improvement of human health, production or testing of biological products, and other activity performed by an healthcare facility defined as an institution that has healthcare as its core service function or business. So, World Health Organization defines healthcare waste as waste generated by healthcare activity, ranging from used needle and syringe to solid tracing body parts, diagnostic samples, blood, chemical, pharmaceutical, medical device, and radioactive materials. So, those are healthcare waste products generated from healthcare facility like glove, syringe, needle, and vial, ampoule, and so on. Those are also healthcare waste products. Those are also. So types of healthcare waste. There are two types of healthcare waste. Those are risk waste and non-risk waste. Risk waste, healthcare risk or risk waste products. Healthcare risk waste is any waste that poses a risk due to its potential infectious nature. Risk waste is further subdivided into 7 groups. Those are infectious waste, pathological waste, sharp, pharmaceutical waste, genotoxic waste, chemical waste, and radioactive waste. So let's see each one by one. Infectious waste means this is the waste contaminated by any type of bacterium, virus, parasite, or fungi, which includes culture or agar from laboratory works, waste from surgery or autopsies, or post-mortem or dead bodies, waste from infected patient, waste from infected hemodialysis patients, infected animal from laboratory, animal material have been in contact with infected patients. Those are infectious waste, like those. Next, pathological waste. Pathological waste consists of recognizable human-derived tissue, organ, and body parts, as well as vertebrate animal-derived tissue, organs, and body parts used in research. Pathological waste type of healthcare waste includes human or animal tissue, human or animal organ, body parts, feces, blood, and body fluids. All are pathological wastes. Let's see with pictures. Example: this is a human heart, so it is like anatomical waste. And those are placenta, so it is one type of anatomical waste or pathological. The next we will see what are sharp waste. Sharp wastes includes the following whether infected or not, such like needle, sharp scalpel or surgical blade, infusion set, surgical bloods, broken glass, and any other items that can pierce skin, cutting punctures. So those are sharp wastes. If those are infected or not infected, but they are generated from healthcare facilities like needle, syringe, and those are different materials used for laboratory diagnosis or take samples. Those are also sharp wastes. So the next we will see what are pharmaceutical wastes. It is include expired or unused pharmaceutical products, spilled or contaminated pharmaceutical products, surplus drug, vaccine, discarded items used in handling pharmaceutical, for example, bottle, glove, mask, tube, drugs, so on. So those are expired or unused pharmaceutical wastes like medication and so on. And those also pharmaceutical wastes. So the fifth one is genetic waste. It is highly hazardous, mutagenic, teratogenic, or carcinogenic, such as cytotoxic drugs used in cancer treatments. Genotoxic waste derived from drugs generally used in oncology or radiotherapy units that have high hazardous, mutagenic, or cytotoxic effects. These waste include cytotoxic drug and outdated materials. Vomiting, face, or urine from patients treated with cytotoxic drug or chemicals, contaminated materials from the preparation and administration of drugs such as a syringe, vial, or bottle that contain drugs, especially a sealed sterile container for injection by needle, and etc. Like those are genotoxic wastes. Those are also cytotoxic or genotoxic wastes. The sixth one is chemical waste. These are disinfection solvents used for laboratory purposes, battery and heavy metal from medical equipment such as mercury from broken thermometer. Chemical waste can include the following. Those are chemical from diagnostic and experiment work, cleaning process, housekeeping and disinfecting procedure, mercury waste such as from broken chemical equipment spillage. So those are those wastes. Those are also chemical wastes. So the last one is radioactive waste. This waste include liquid, solid, or gaseous waste contaminated with radionuclides generated from in vitro or outside analysis of body tissue, fluid, in vivo or body organ imaging, and tumor localization and investigation and therapeutic procedure. It can also consist of any glassware or other container contaminated with radioactive liquids. So radioactive or nuclear waste is byproduct from nuclear reactors, fuel processing plants, hospital and research facility. So this waste is also generated from fire decomposition and disseminating nuclear reactor and other nuclear facilities. So those are an example of radioactive wastes. So the next one is non-risk waste. So this waste that does not pose any particular biological, chemical, radioactive, or physical hazards, such as may include paper, cardboard packaging, food waste, aerosol or sprays. Those are non-infectious waste, or those are does not pose any particular biological hazards to in the human beings. Those are infectious